All right, we are just going to go over some hip mobility for internal and external rotation and a little bit of stretching that you can do to stretch your nerves that run through the glutes, through the back of the leg, so your sciatic nerve, your peroneal nerves, and your tibial nerves. These are all important for improving the way the pelvic floor muscles work. So the better the bones of the pelvis move and articulate, and the better mobility that the nerves have, the better the muscles of the pelvic floor are going to be able to work and function. So first, just start out, you can use anything for a little support like a couch or chair. You're going to come into a half kneel position, and the outer leg you're going to pick up, rotate out, rest, and same thing in reverse, coming over. So as you do this, you want to keep your foot elevated so that it's not hitting the floor as you rotate, and really just take your time feeling your hip move through this range of motion. You want to complete about 5 to 8 of these on each side. The next one you're going to do is you're going to come into a seated position, cross one leg over the top. All you're going to do is push this knee down a bit. You're going to stay tall and just gently lean forward. So you're not resting your chest forward, you're staying tall and hinging ever so slightly from the hip while maintaining a little bit of pressure downward. You're going to hold this for about 30 seconds. Take some nice deep breaths while you're here, thinking of breathing into your rib cage 3-dimensionally. And then you're going to switch, go on to the other side, do about 30 seconds, 3 to 5 times on each leg, whatever feels good for you. From there, you're going to point your toes up, straighten your leg. Again, back stays tall, hinging from the hip, not slumping forward. You're going to keep your toes pointed towards you. You're going to look straight ahead, hinge from your hip, and stretch forward. As you stretch forward and hinge from your hips, you should feel a nice stretch through the back of your leg down to your calf. Hold this for a few seconds. Then you're going to rotate your toes in, lean forward again, hold for a few seconds, and then rotate your toes out. So you're going toes up, toes in, toes out. About 5 to 10 seconds in each position, and about 5 times in each position, both legs. From there, you can come into a seated position on the floor. You're going to keep your knees up. You're going to come back, a little bit of an angle. So you're not staying straight here, you're coming back into a little bit of an angle. You're going to slowly and with control drop one knee in while keeping your pelvis as straightforward as you can. So you're going to try not to allow this hip to come up to achieve more range here. You're just going to work with what you have. So just drop your knee in, hold about 5 seconds, come back up, and repeat a few times on each leg. You might notice that one hip seems a little bit tighter than the other. If it feels like it's too much of a stretch, come even wider with your feet and drop down. From here, you're going to come into a 90-90 position. So left leg is bent in front, right leg is bent behind. You're 90 degrees in each leg. Come forward so that your hips are like high beams on a car, right? We're not rotated one way. We're staying really as straight as possible here. Chest is up, lean forward. Keep your hands in front. You can rotate side to side. A few times you can come forward and back. Just kind of play around with what you feel you need here. And come back up slowly. And go right back into that same side. You want to do the same side a few times. And then you'll do the opposite side. Same thing. And then your next stretch will be rotating through this whole range. So hands are in front of you. You're really using your core to move you and using your hips to rotate through space here and coming back. And you want to do that whole sequence front and back about 10 times.